Hello viewers, welcome to our channel. This is part 2 of our blood pressure series. In this video we will learn what is high blood pressure or hypertension, the signs and symptoms of high blood pressure, and the causes of high blood pressure. So without wasting much of your time, let's get started. High blood pressure, which is also called hypertension, is elevated blood pressure. Depending on your activity, your blood pressure varies throughout the day. A diagnosis of high blood pressure may be made if your blood pressure readings are often above the normal range of 120 by 80 mm of mercury. Your chance of developing additional health issues such as heart disease, heart attack, and stroke increases as your blood pressure levels rise. By examining your systolic and diastolic blood pressure readings and comparing them to values contained in certain recommendations, your medical team can diagnose high blood pressure and decide on a course of therapy. It's possible that different medical professionals will use different standards to diagnose high blood pressure. Here we will discuss two different standards that were used by medical experts to diagnose high blood pressure. Number 1, as per this standard, if a patient's blood pressure is continuously 140 by 90 mm of mercury or greater, some healthcare providers will diagnose them with high blood pressure. The Joint National Committee on Prevention, Detection, Evaluation and Treatment of High Blood Pressure's 7th report from 2003 served as the foundation for this upper limit. Number 2, according to this standard, patients are classified as having high blood pressure by other medical experts if their readings are regularly 130 by 80 mm of mercury or above. American Heart Association Guideline for the Prevention, Detection, Evaluation and Management of High Blood Pressure, which was published in 2017, provides the basis for this limit. Consult your medical team about your blood pressure readings and how they impact your treatment plan if you have been diagnosed with high blood pressure. Now let's know some signs and symptoms of high blood pressure. Most often high blood pressure has no symptoms or warning indications, and many individuals are unaware they have it. The only method to determine whether you have high blood pressure is to measure it. Irregular heartbeat, fatigue, nosebleeding, blood in the urine, severe headache, difficulty in breathing, or pounding in your chest, neck, or ears, and regular chest pain are some of the common symptoms of high blood pressure. If you are experiencing any of these symptoms, then you must get your blood pressure checked by your medical team. There are many other symptoms, but that is not possible to discuss them all. Now let's discuss some well-known causes of high blood pressure. Number 1, unhealthy diet. To prevent high blood pressure and its problems, pick a healthy meal and snack selections. Ensure that you consume a lot of fresh fruits and vegetables. You must have a discussion with your medical team about consuming a range of foods that are low in salt and saturated fat, but high in potassium, fiber, and protein. Making these healthful modifications will help many people maintain low blood pressure and save them from heart disease and stroke. Number 2, limited sleep. Your general health depends on getting adequate sleep, which is also necessary to maintain the health of your heart and blood vessels. Regularly lacking sleep is associated with a higher risk of heart disease, high blood pressure, and stroke. Number 3, overweight or obesity. Your risk of high blood pressure rises if you are overweight or obese. Doctors frequently analyze your body mass index to see whether your weight is within a healthy level or not. You may determine your body mass index if you know your height and weight. In order to determine body fat, doctors occasionally measure a patient's waist and hips. You should also discuss strategies for achieving a healthy weight with your medical team, such as making appropriate food selections and engaging in regular physical activity. Number 4, high alcohol consumption. Avoid excessive alcohol consumption, which might cause your blood pressure to rise. Men shouldn't have more than 2 alcoholic beverages daily, while women shouldn't consume more than 1. Number 5, smoking. Smoking increases your risk of heart attack and stroke and boosts your blood pressure. Don't start smoking if you don't already. If you already smoke, stopping will reduce your chance of developing heart disease. Your doctor may provide suggestions to assist you with quitting. Number 6, less or no physical activity. You can maintain a healthy weight and decrease your blood pressure by engaging yourself in physical exercise. Adults should engage in at least 2 hours and 30 minutes of moderate intensity activity each week, such as brisk walking or bicycling, that equates to around 30 minutes a day, 5 days a week. Kids and teenagers should engage in 1 hour of physical activity every day. This is the end of the second video of this series. If you are watching this video on YouTube, please subscribe to our channel for more informative videos, and if you are watching this video on Facebook, then like and follow our Facebook page. Thanks for watching.